The condition that Anna suffered from is a stroke. A stroke is essentially a brain attack where the blood supply to the brain is cut off, resulting in a death of brain cells. There are three types of stroke: an ischemic stroke, a hemorrhagic stroke, and a transient ischemic attack, also known as a mini-stroke. An ischemic stroke is the most common type of stroke and occurs when a blockage cuts off blood supply to the brain. A hemorrhagic stroke occurs due to bleeding in or around the brain. Lastly, a transient ischemic attack is similar to a stroke, but the symptoms only last for a short amount of time as the blockage in the brain is only temporary.
The first thing we need to do as doctors is to try and figure out and diagnose the type of stroke an individual has. As doctors, we use the help of technology to do just that. So in the case of Anna, we would first need to perform a CT scan or an MRI scan. A CT scan is technology that is able to take multiple images, which is then able to produce a 3D picture of the area of interest. And in the case of a stroke, it would allow us doctors to visualize Anna's blood vessels and then be able to determine the exact type of stroke involved. An MRI scan may also be used, which uses both a strong magnetic field and radio waves to produce a detailed image of the internals of the body. Similar to a CT scan, this would also allow us to determine the exact type of stroke involved by visualizing the patient's blood vessels. In some cases, both a CT scan and an MRI scan may use a special dye that is injected intravenously into the patient's blood vessels to improve the clarity of the image. Finally, other additional tests may be done to find out more about the stroke. This includes blood tests, electrocardiogram to see the heart's electrical activity and any problems that may arise due to a stroke, and finally, carotid ultrasound to check if there is narrowing or constriction due to blood clots from the stroke in the neck arteries.